My mom's total bill in the final 10 months that she battled cancer came to an astounding $709,440. She ultimately lost that fight in January of this year, and for those who follow the channel, you know that she was an important part of the ideas and videos here. Well, here is her last gift to you, and we get to break out the whiteboard again. Let's go over how that massive amount would be handled if someone was covered by original Medicare only versus original Medicare plus a supplement plan G versus a typical Medicare Advantage plan. Now, why are we including Medicare only in this one? Well, there are a lot of people who don't like the idea of private health insurance companies or paying more for health insurance and will not consider the idea of a supplement plan or an Advantage plan. So this category is for those of you. The major costs over the past 10 months really came from just two areas. $138,000 came from 3 extended hospital stays, those are Part A expenses, and a large percentage of the remaining $570 some odd thousand came from chemotherapy treatments, which are Medicare Part B expenses. Now here's how it all broke down. It's not perfectly chronological and instead broken into Part A and Part B expenses. Starting with Part A, she developed pneumonia in late April of 2023, which led to a 7-day hospital stay. And this is where medical billing gets super weird and it can be frustrating. My hope is that this helps those of you looking through your statements try and make sense of what's happening. The Medicare approved amount that she was billed was just over $47,000 for that 7-day hospital stay. Now the actual amount Medicare negotiated to pay was $9,600. That $37,400 difference just disappears. With original Medicare only in 2023, the Medicare Part A deductible was $1,600. So if she just had original Medicare only, she would have paid $1,600. Medicare Part A pays the other $7,000. With a supplement plan G, just having the plan, I'm using an average premium here in our area for a 70-year-old because she was 70 years old at the time, and these numbers do typically change based on your age, but just to have the supplement plan is about $165 per month. For all 12 months in 2023, plus the month in 2024 that we'll cover, that's about $2,000 in premiums just to have the supplement plan G. So using the same numbers as before, she was billed $47,000, Medicare agrees to pay $9,600, and the supplement plan takes care of the $1,600 Medicare Part A deductible. Medicare Part A still pays the $7,000, and the supplement plan has almost paid for itself already. It's $2,000 per year just to have it, and then it just picked up $1,600 in that Part A deductible. Now with an Advantage plan, most don't have a monthly premium. You have the plan without having to pay anything. In this instance, that is a $2,000 savings compared to the supplement plan. Advantage plans have a maximum out-of-pocket number where once you meet that, you do not have to pay any more for the rest of the year for approved procedures and services. The plan takes care of the rest. We'll be keeping track of this throughout the video. For this example, we'll use a plan with a $5,000 max out-of-pocket. Inpatient hospital stays are handled similarly across most Advantage plans, but the numbers do change by plan and area. It's typically a set dollar amount per day that you're in the hospital for a certain range of days. For example, a typical plan in our area of the Intermountain West is $350 per day for days 1 through 5. There are some plans that are just days 1 through 3 or days 1 through 7 or anywhere in between, but for this exercise, we'll use days 1 through 5. She was in the hospital for 7 days, so she is responsible for $350 per day for the first 5 days for a total of $1,750. The plan takes care of those days 6 and 7. That $1,750 is subtracted from the $5,000 max out of pocket, giving a total of $3,250 left to meet the maximum out of pocket for this plan. So right now, original Medicare only is slightly winning from a cost perspective of just that $1,600, then the Advantage plan at $1,750 in copays, then the supplement plan with the $2,000 annual cost and premiums to have the plan, even though it picked up the $1,600 Part A deductible. But that's all about to change in quite a dramatic fashion. Sticking with Part A costs, she had another multi-day ER visit for pneumonia at the end of December 2023, and she was admitted in the hospital. And the timing of this will be very important here soon. The Medicare approved amount billed was just over $46,000. Medicare agreed to pay $12,000. Now, Part A has a unique benefit period that resets after you have been out of the hospital for more than 60 days. That hospital visit in April was more than 60 days out from this December visit. So she has another Part A deductible to pay with original Medicare only. And the deductible is the same $1,600 with this event, still being in 2023. With original Medicare only, you can have multiple Part A deductibles in a given year. The Medicare paid amount drops to $10,400 after that deductible is taken out. On the supplement plan, same story here as it was before. The supplement plan picks up the Part A deductible of $1,600, meaning that with these two Part A expenses, the supplement plan has covered $3,200 at a cost of $2,000 to you. So the supplement plan has given you $1,200 more in benefits than it has cost. On the Advantage side, same story as before, a daily copay of $350 per day multiplied by the first 5 days for a total of $1,750. Subtract that from the $3,250 we had left in the out-of-pocket max, and we're at $1,500 left to meet that maximum out-of-pocket for this plan. At this moment, the supplement plan is winning from a cost perspective with the $2,000 you had to pay to have it. Original Medicare only is in second place at $3,200, and the Advantage plan is in third with $3,500 in copays. One last Part A experience: about 10 days after she was released from the hospital stay in late December, she crashed and she was admitted again. This time it was early January 2024. The new year will make a difference for one of these plans. Medicare approved amount was $46,000 again. Medicare paid $15,500. On Original Medicare only, remember, once the Part A deductible is paid, your benefit period lasts until you've been out of the hospital for more than 60 days. Well, she was not out of the hospital for more than 60 days. It was about 10. So she would not have another Part A deductible to pay because she is still within that same benefit period. Even though it's a new year, she is still within that same benefit period. With the supplement plan, these plans pay secondary to Medicare and follow the same rules. So with it being the new year, her premiums for January would be the only cost that she needs to pay, and that is still that $165 per month. With Medicare Advantage plans, they typically do not have the same Part A benefit period arrangement, and the maximum out-of-pocket resets on January 1st. So we have two things that we need to deal with here. Number one, she was in the hospital for 3 days before she ultimately passed away. 3 days at $350 per day would mean $1,050 in copays. Number two, and stay with me on this one, since the maximum out-of-pocket resets on January 1st, even though so far we haven't hit the max out-of-pocket yet in this video, that's only because we've only been going over Part A expenses. We haven't gone over Part B costs yet. On the Advantage plan example that we're currently using, we definitely would have hit the max out-of-pocket well before December. So once January 1st comes around, this copay starts up again, and it can be a shock to people who hadn't been paying anything for a while because they had already hit their maximum out-of-pocket. You just need to be aware of the new year with Advantage plans. Okay, that wraps up Part A costs. We still have Part B, but let's recap the Part A winner so far. The winner is the supplement plan with a total cost for these 10 months at around $2,000 in premiums. Next is Medicare only, no other plan, at $3,200. Finally, the Advantage plan copays really add up here to about $4,550. And if you stop here, you're going to miss out on how this order will, and I promise it will, change, and it'll change in quite a dramatic fashion. Last note on this, if you are looking at an Advantage plan and you're worried about these Part A inpatient copays, there are specifically designed plans called hospital indemnity plans that you can pick up for relatively low monthly premiums that will help pay for those copays. If you go inpatient and have a hospital stay, these plans will pay your daily copay amount if you set it at that. We have a video that goes over these, and you can find that link in the description of this video. Okay, it's time to move to Part B, but before I do, about 90% of you who watch our videos are not subscribed to our channel. If you found value in this video or any of our other videos, would you please click that subscribe button? It helps more than you know, and we can keep making important videos here on YouTube. Okay, Part B, it's your turn. With all three of these arrangements, Original Medicare only, Supplement Plan G, and the Advantage plan, you still have a monthly premium to pay just to have Medicare Part B. In 2023, that was $164.90 per month as the base amount, or about $2,000 per year. This number can be higher for those with higher incomes and lower for those with lower incomes, like Medicaid eligible folks. So we'll build that $2,000 into this total cost picture here at the end. Total Part B Medicare approved billed charges over this 10-month period were a whopping $570,000. Again, most of that coming from chemotherapy treatments. Medicare agreed to pay about $375,000. Basically, Medicare says you can bill us $570,000, but we're only going to pay you $375,000, and hospitals that participate with Medicare say, okay, fine. With Original Medicare only, she would have had the Part B deductible, which was $226 in 2023, bringing the total amount owed to a measly $374,774. That was a joke. That is still a ton of money. And then of that still basically $375,000, she would be responsible to pay for 20% with no maximum. In this case, that would be about $75,000 she would have had to come up with to pay for those 10 months of visits and treatments. With a supplement plan G, she would still have that Part B deductible of $226 when this all happened in 2023, and then the supplement plan covers the rest. This is insane coverage. With the Medicare Advantage plan, specifically for chemotherapy, she would have to pay 20% of the total cost. This percentage is called a coinsurance. She would pay that 20% until she hits her plan's max out of pocket, which is $5,000 in this instance. So even though the Advantage plan has the same 20% coinsurance for chemo that original Medicare only had, the Advantage plan has a cap or a limit on how much you would pay, where original Medicare only does not. With the procedure she would have hit her max out of pocket in early April before she had any of the Part A stuff that we talked about earlier. So in this case, she wouldn't have even seen those $350 per day copays in 2023 because her out-of-pocket max was already met when those happened. Again, once you meet your out-of-pocket maximum, you don't pay anymore. The plan takes care of all remaining approved charges. With the Advantage plan, in this example, the maximum risk and dollar amount paid here was $5,000 in 2023, and then an additional $1,050 in 2024, because remember that maximum resets at the new year, so for a total of $6,050. Now let's look at the totals, and let me warn you, don't end the video after these totals. There are important variables after this that could change the results for you. Total billed is $709,000. There is rounding in all of these numbers. Medicare paid around $330,000. In last place is original Medicare only, and by a lot. $3,200 in Part A costs, $2,000 in Part B premiums, $226 for the Part B deductible, and about $75,000 in Part B coinsurance for a total of $80,500. Oof. In second place is the Medicare Advantage plan with a maximum out-of-pocket in this instance of $5,000 for 2023 and an additional $1,050 in 2024, plus $2,000 in Part B premiums for a grand total of $8,050. In first place, the supplement plan comes in at $0 in Part A costs, $2,000 in Part B premium costs, $226 in Part B deductible costs, and about $2,000 in supplement plan premium costs for a grand total of $4,226. Now, we have a couple of important notes to finish this out to give the full picture of your options here. I mentioned the hospital indemnity plans earlier that help those on Advantage plans reduce the cost risk of inpatient hospital stays. There are also separate cancer policies that help you if you choose to get one. This is an approximation based on our area, but for around $50 per month, you can get both plans, the hospital indemnity plan and the cancer plan that would cover your hospital copays and or your Advantage plan max out of pocket for the year if you were diagnosed with cancer. You're able to set your coverage amount for both of these. For cancer, we typically recommend setting the amount at double your plan's max out of pocket so that you're covered in the event that the diagnosis and treatment span 2 years, like what happened with my mom. With the hospital indemnity plan, you can set it at your copays for the certain number of days. In this example, you could set it at $350 per day for days 1 through 5. The point here is that there are ways to make the Advantage plan arrangement more cost-effective for you if you are thinking of going that route. In certain areas, that max out-of-pocket is way less than $5,000. In other areas, max out-of-pockets are more than $5,000. So where you live and which plan you choose matters. Also, there are Advantage plans that reduce the Part B premiums, but these are the exception, not the rule. Typically, these plans have higher out-of-pocket maximums, so there is a trade-off, and we don't recommend chasing Advantage plans just because of the Part B buyback. There are more important coverage benefits to focus on first. On the supplement plan side, supplement plans do not cover prescription drugs, dental, vision, or hearing. So if you have any of those things going on, you would have to purchase separate plans that have their own monthly premiums, deductibles, copays, and coinsurance amounts. This would raise the supplement plan route costs, not the supplement plan itself, but the route of going with a supplement plan, reducing that gap between the supplement plan and the Advantage plan a little bit, because most Advantage plans come with all of this stuff included. We did not go over prescription drug costs here. In my mom's case, she was fortunate not to need any expensive prescription medications. She had a handful of generic medications that did not make a significant impact in costs, but for some, drug costs are very high and a more important part of this story. Lastly, and I could go on for another 30 minutes with details, but we'll end on this one. With a supplement plan, you can go to any provider or facility that participates with Medicare anywhere in the country. With an Advantage plan, you have a network that you would want to stay in, and not all providers or facilities participate with Advantage plan networks. So what did my mom have? Based on her 28-year history of battling cancer and her work offering her an HRA into retirement to cover premiums, she had a Medicare Supplement plan. Medicare, coupled with her supplement plan, meant that on that total amount of around $709,000 billed, she had a total out-of-pocket cost of around $4,200. She, my siblings, and I didn't have to worry about which hospital we took her to. She got to choose the same oncologist that treated her 28 years ago, and we haven't had to deal with a single hospital bill. Do I love supplement plans? Yes, I do. Do I recommend supplement plans for everyone? No, I do not, for reasons that I don't have time for in this video, but that I cover right over here. Thank you for spending some time with me, and I will see you over there.